Well, the importance of the 7 steps really is to give a structure to our hearing care assessment. So the 7 steps really gives that structure that we need as clinicians, and then the patients and their family need when they come in to us for their hearing care assessment. Step 1 is the case history. We begin with the case history where we want to get to know the patient that's sitting in front of us and to know what stage of their hearing journey they're on. As well as that, we need to introduce ourselves to them. We tell them about us, about our experience, we put them at ease. Step 2 is a videotoscopy. Before we begin that, we explain to the patient why we do it. So what we do is we begin by examining the back of the ear first. Around the ear, we touch the mastoid bone to make sure that there's no pain or swelling. Then we proceed with videotoscopy where the patient can see what we are looking at ourselves on the screen in the room, and they can see if there's any wax blockages, if there is an infection, if there is a perforated eardrum, and from there onwards there's no stopping as the test goes ahead further. Step 3, pure tone audiometry. What that involves is us blocking the patient's ears by little inserts and giving them a button so they can respond to the little beeps we're going to play in their ears during the test. For patients with tinnitus, we play a different tone than just a steady beep. We need to establish what are the faintest sounds they can hear. At the end of the test, we go through what we call an audiogram. We tell them exactly where the hearing test result is plotted on that audiogram. We tell them you have an okay hearing, you need help, or your hearing is at a level that we need to take extra care and see how we can help the patient. Step 4 is the familiar voice test. So what we ask the testee to do is respond to words that their support is reading out from a list of words we give them. The list of words are read in background noise, and that is really to make it as close to real life as possible. This is a really important test because it's a real life test. We don't hear beeps in our ears. We hear spoken words, and that's why carrying out that part of the test actually brings it home, both to the patient and their support, because they're now able to see what difficulties they're having and where exactly they are. Step 5 is the hearing aid amplification demonstration. During that part, what we do is we demonstrate if hearing aid amplification is needed and what difference it would bring to the patient. The reaction can be so emotional. We've had tears in the room, we've had laughs, we've had, I don't believe this. Is this the way she normally talks? The reaction is overwhelming. It's really what makes it worthwhile. It's what makes me get out of bed in the morning. Step 6 is the fitting of the hearing aids. When the patient comes back for that appointment, they are shown how to use the hearing instruments. They're shown how to maintain them, how to clean them, how to charge them if they're rechargeable hearing aids, how to basically care for them. Step 7 is the follow-up and aftercare. What we do is 2 weeks after the fitting appointment, we invite the patient to come back in for a follow-up appointment. And from there on, we look after them for life. We invite them to come in binaurally, normally, but they know we're always here for them. It's not just an appointment they need with me. Sometimes they can just pop into clinic and our very experienced clinic coordinators help them with whatever issues they might have. We pride ourselves on our aftercare. The 7-step consultation process is absolutely vital. It's a life-changing process if you look at it like that. You come in for an hour of your day. Your test is carried out within 45 minutes to an hour and 15 minutes. But then the result of that could be life-changing both to yourselves and your families and the people that you love. We are here to witness that journey day in, day out. We're passionate about it, and to us, it's an absolute privilege being included in that.